All right, welcome to our live stream. This patient just had the Deuk laser disc repair done to fix his discs, or a disc. Now we're going to be treating his facet joints. Now he has back pain. He's had it for years. How many years has he had back pain? 15 years of back pain. And he has back pain that's coming from, we said 11 different sources, 11. 2 of them were discs. The other 9 are not discs, but facet joints, 6 facet joints. Facet joints are small joints in the back of the spine. Every disc that we have in our spine, we have 2 facet joints. And it turns out the facet joints are the second most common cause of back pain. Shot. And the disc being the first. Huh?
You've done this before.
I've done it a couple of times. I stayed at a Holiday Inn Express.
I say that all the time to my patients.
Yeah? That was the best commercial, wasn't it? Shot. All right, so I'm almost at the perfect spot, but I'm right on the TP. And basically, what we're doing is a rhizotomy. It's a denervation procedure. Okay? So there's 2 ways you can fix. That's the perfect spot. See that? Right there. You got show us that, Jordan. Look at the transverse process, follow it lateral to medial, and then look how it slopes up right where my tip is. It goes into the facet joint. Okay? And then you got, yeah, that's the facet. So I'm literally burning this pain nerve right at its, like right where you're supposed to. So other doctors do a procedure called an RFA. The problem with RFA is it doesn't work. And if it does work, it never lasts. Shot. So we decided at Deuk Spine we were going to make it better. And we improved on the RFA by developing a new technique called the Deuk, that's the perfect spot, the Deuk plasma rhizotomy, which is what we're doing right now. We've been doing this treatment now for a couple of years. Shot. And we've had incredibly good success. Nobody's come back to have it redone. So it's permanent. And the reason it's permanent is if you look at an RFA, it can't be permanent because it's not performed properly to be permanent. Basically, you can't destroy a nerve with that skinny little RFA needle. So what we do that's different is we have more energy being delivered and we wand. Wanding means moving. We move our tip of our probe where it's creating plasma, we move it around and in the area of the pain nerve to make sure it's destroyed. And the results have been spectacular. We've been curing facet joint pain, and we've taken the same treatment and applied it to the SI joint. And we've been curing SI joint pain as well.
Dr. Deuk, can you explain what surgery this replaces?
Sure. This replaces a fusion. The alternative is a fusion. I used to do fusions for patients with facet pain because it works. I mean, and if you're doing it for the knee, it's a joint replacement. All right. You guys see where we need to go? Jordan, you see it? Shot? Yep, that's exactly where we need to go. This is where we have that really weird facet. And I feel it pushing me away, literally pushing me away from where I need to go. That giant facet. Shot? I may need another tip. Shot? That's a little bit better, Jordan, huh? All right, there we go. All right, any questions, Henry?
Yes, this is coming from Iman on Facebook.
Hello, Iman.
This is from, I believe, from the past live stream asking, thank you for the live stream. Can you show us the nerves?
No, I can't show you the nerves. Not now. The nerves are inside the body. We're not taking them out, Sean. We're burning them right where they are. That would be like me asking you to show me a fetus once you've created it. You never want to do that because the fetus won't be alive anymore. We're doing something inside the body percutaneously so that we don't have to open the patient up and show you anything, okay? This is a minimally invasive procedure. It's done through the skin, percutaneous. Shot? All right, so that's probably 4 there, 5 below, 3 above. Hold on. I mean, we can put some medicine, go ahead. So right now we're performing a procedure called the Deuk plasma rhizotomy. It was pioneered by me here at Deuk Spine Institute. Where was the needle going in? I want to be a little higher. And I pioneered it out of necessity because we were finding that the RFAs didn't work or didn't last. And everybody knows that. And that's why they just keep having the patients coming back over and over again because, well, the RFAs don't work or they don't last. They may work temporarily, but they don't last. So if you get relief from an RFA, it's going to go away. It's just a matter of time. Shot? All right. So we can't show you the nerve. We can show you where it is, but the x-ray won't see the nerve. Shot? See where the tip of this thing is? I can't get more medial. But that's pretty much where the nerve is. Just medial to that tip right there. I keep lifting my hand, it keeps moving, but shot?
He's moving or?
No, it's not him, it's me. Nothing, don't worry, you're not doing anything wrong. I'm just explaining that my probe is moving. Shot? Yeah, no, he's perfect. From an anesthetic standpoint, he's not moving at all. Shot? I meant the fat. His muscles and fat are pushing my probe, so I have to hold it with the, what is this thing called?
That's a sponge around.
It's the OBGYN sponge holder. Shot? Luis is like, yeah, huh? All right, let's see here. There we go.
So, for the audience, burning the nerve has no effect other than, on anything other than pain control.
Yeah, that nerve has no job other than taking pain to your brain from the facet joint. And some people say, well, maybe you shouldn't be burning the nerve that's bringing pain, but I mean, it's the only treatment that really works to get rid of the pain. So yeah, you do want to burn it. I mean, you can do a fusion. Fusion's a lot worse. I haven't burned yet because I'm not happy with the positioning yet. Shot? How come I'm not seeing? And after I finish this, we're going to go on to the SI joint, sacroiliac joint. Jeez. Any more questions, Henry?
No current questions, but we do have a comment from a patient who is 4 months post-op and their neck is healing and continues to feel so much better these days thanks to you, Dr. Deuk.
You're welcome.
Dr. Deuk.
You're welcome. It's my pleasure. Yeah, we love to hear our success stories from patients. We do have quite a few now that come to us from YouTube, from watching, you know, learning and watching. And that's what we want. We want people to learn. They have choices, you know. They don't have to have fusions anymore. They don't have to have pain pumps, stimulators, and laminectomies. Those are old procedures that unfortunately many doctors still do because they don't know any better, you know. And, you know, your doctor is not going to admit to you, oh yeah, I don't know the newest technology, right? What's going to happen if you go to the doctor and they say, I don't know the newest technology? You're going to leave, right? They know that. So they don't want to tell you they don't know the newest technology. Shot? They never want to tell you I don't know the newest treatments. But, you know,
My experience is if they don't know how to do it, or never heard of it, they just automatically say that doesn't work,
yeah.
because they don't want to lose the patient.
Yeah, they don't want to lose the business. But, you know, doctors should not be looking at patients as business. They should be looking at them as a person who needs their help and needs them to do what's right for them. And that's the way we see our responsibility at Deuk Spine. That's what drove us to develop these techniques. Shot? All right, nice. This is a really good, I feel the bone. You want to feel the transverse process. All right, just about done. And we're going to do the last one at the bottom there. You can see the spot. Shot. Jordan, show us. It's too medial.
So
Yeah.
just for the audience,
Shot.
what's the relative complication of doing this versus a fusion?
Shot. A fusion is far more invasive. Has a higher complication rate. It's more painful, longer recovery. I mean, fusion is just a totally unnecessary procedure anymore. I mean, I used to do fusions all the time, right? I did them because that's all I knew how to do. And it was the best treatment available for a while, but not anymore. All right, we're going to move on to the SI joint. Pressure, both sides. Shot. It's the right side, correct? Everyone is in agreement? Go ahead and close the others with the stapler. We're going to do the SI joint right now, and then we're going to shot. We're going to do the piriformis. All right, could be a little higher. I may need one more tip.
Please, thank you.
Any more questions?
So far at this moment, no current questions.
Shot? No current question. You guys know everything.
Oh, we just got a question. This comes from Fiona on YouTube.
Fiona, hi. Welcome to our live stream.
They said, hi, Doc. So this is all done by feel. You're using your expertise. Is there any chance that you can miss? Thanks.
Yeah, Fiona, it's not done by feel. Do you see the x-ray pictures? I mean, those x-rays are guiding me. Shot? You guys do see the x-ray picture, right? Henry?
Of course, yes.
You're showing the audience the x-ray, right?
Yes, 100%.
All right. Fiona has me worried.
I can assure you we see the fluoros perfectly.
Okay. Yeah, Fiona, so I'm using an x-ray to guide myself. Shot. I feel the bone right here. and I'm marching along it, and I'm severing any pain nerves. You see that, Davis?
Yeah.
Shot?
I see the,
But you see the Deuk shuffle, right?
get the hopping.
Got the hopping, the sliding.
We have another question.
Uh-huh.
This comes from Toby on Facebook.
Shot. All right, Toby.
Toby said, "Hi Doc. So I have a fusion S1 to L4 or L4 to S1, and my pain management guy will no longer do denervation / rhizotomy as he think it may catch and heat up the fusion hardware. What are
No.
your thoughts on this?"
No, that's nonsense. I mean, you need a real pain management doc. It will not catch and heat up your hardware. It's like I don't want to go out in the country on Friday night. Jordan, shot. Is that it? Yes, sir. Because I might have little green men come down in a flying saucer and abduct me and stick things in my rear end. Maybe I do want to go. I'm kidding. But seriously, that's just a load of horse crap. Your pain management doctor, I don't know, maybe he's just feeling bad about doing procedures that don't work. Or maybe he doesn't like you. I don't know. Maybe your insurance didn't pay him. I don't know. But there's another reason besides that. That's nonsense. Yeah. But come here, let us do your radio frequency ablation, RFA, or let us do the DPR, which is the best treatment for your problem. That's what we're doing right now. Okay? That's my advice to you. All right, we're done. Let's go to the piriformis. We're going to go ahead and end the stream. And next, we're going to bring you back. This patient has torn muscles in the buttock called the piriformis syndrome. We've treated it for years with shots, therapy, sometimes Botox, stem cells, everything you can imagine. And then those patients, it didn't work, we do what's called a piriformis release. So that's what we're going to do next.